More than 46 million. Rarely does a day go by in the debate over health care where we don't talk about the number of uninsured Americans. But who are they? Bloomberg's Lizzie O'Leary is in Washington now with more on that story. Lizzie, good afternoon.
Hey, Mark. Well, 46 million can be kind of a tough number to grasp. There are some trends here, though, that can help put a face on that population and about who stands to gain if they do get coverage.
Marcus Grimes is 38. He loves poetry, playwriting, and basketball. He's also blind. Blind from a degenerative eye condition that his doctor could have treated if he'd had health insurance.
Fix it. I asked, is it fixable? And he says, yeah, we could repair it. And he said, but because you don't have insurance, you're going to need $3,000 down minimum, before we can do anything.
Yeah. Grimes was earning $43,000 teaching high school English. $3,000 out of pocket was far too much. So was $500 a month to buy into the school's health plan.
Because I had a pre-existing condition of diabetes, I couldn't afford the health care premiums.
7 years later, all he sees are gray halos.
I miss it. I miss my students, my kids.
Here's how Marcus Grimes' case was typical. Most of the uninsured, roughly 70%, work.
Often they work for small employers, or they work in the types of industries like service jobs that are just a lot less likely to offer health care.
And they don't make much money. Nearly 2/3 have incomes 1 or 2 times the poverty level, but they make too much money for Medicaid. A disproportionate number are young, between 19 and 29, without the money to pay for health care. They're relatively healthy, and they could be attractive to insurers if a federal subsidy gives them purchasing power.
And so there will be some new customers for private insurers, many of whom will be getting subsidies since right now they can't afford the coverage.
Now, that could add up to 30 million more new customers. That's according to one analysis from the Congressional Budget Office of some of these draft bills. It's one reason that analysts have told me that insurers have embraced some sort of health care overhaul, Mark.
Lizzie, it seems that support for a so-called public option is slipping in D.C. What does that mean for insurance companies?
Well, it means a couple of different things depending on the company. Overall, it's probably good for the industry because it might take one competitor out of the mix. But then you have companies like Cigna and Aetna. They offer group plans. They could do better for some sort of group purchasing framework. Someone like, say, a WellPoint, which sells a lot of individual coverage. They may not do as well. Those CBO numbers tend to corroborate that, saying that the group plan buy-in would probably be on the larger side, Mark.
And Lizzie, the president has wanted some bipartisan support on this, but now we're hearing reports that the White House may just say, well, we're going to have to try to ram this through. Are you hearing anything like that?
Well, it's a mix. Publicly, the White House says they would like things to be bipartisan, but certainly you have not seen the kind of unanimity they would like to see across the aisle, and even getting some pushback from those blue dog, fiscally conservative Democrats in their own party. It does not look at this point like we're talking about a big bipartisan bill. At the same time, I would point out that the Senate Finance Committee, they've been the sticker in all of this. They still haven't put out a bill, and they are still trying to wrestle with some type of bipartisan agreement, but it certainly hasn't come yet, Mark.
Bloomberg's Lizzie O'Leary joining us from Washington. Lizzie, thanks.